Between 1 to 2 babies in every 1,000 are born with a hearing loss in one or both ears. It is important to establish whether a baby can hear because early identification is known to be important for the development of the child. The sooner that we know a baby has a hearing loss, the sooner we can help provide the support needed for both the baby and the parents. The newborn hearing screen is offered during your stay in hospital, when a member of the newborn hearing team will visit you to discuss the screen and answer any questions that you may have. It is now possible to screen babies' hearing when they are only a few hours old. The screen takes a few minutes, it's very reliable and is not upsetting for you or your baby. The hearing screen is usually offered during your stay in hospital, either on the labour ward or the maternity ward. Before screening takes place, you'll be asked for consent. The screen will usually be carried out at your bedside when your baby is comfortable and settled. This baby is being screened using the automated acoustic emission, also known as OAE. For this, a tiny soft earpiece is placed in the baby's ear and a quiet, soft noises plays. A hearing ear will respond to these sounds, making a very quiet sound that can be picked up by a microphone in the earpiece. The whole process has only taken a couple of minutes to complete. The baby remained peaceful throughout, and the screener was able to record clear responses in both ears. The screener makes a note of the screening results in the baby's record and shows mum 2 checklists in the child's red health book to refer to as a baby grows. One details the reaction to sounds a baby should be making at a given age, and the other details sound a baby should be reacting to at given ages. The screener is happy with the response received today, but a small number of babies may develop or acquire a hearing loss. It is important to keep a check on your baby's hearing. If you have any concerns at any age, then tell your GP or health visitor. Most babies will have a hearing screen before they leave hospital. If your baby is not screened before you leave or is not born in a hospital setting, you will be offered a newborn hearing screen before your baby is 4 weeks old. This will usually take place in an outpatient's clinic.
Clear responses can be recorded from an OAE screen for most babies who can hear, but for a number of babies this may not always be possible because of an existing permanent hearing loss, noises in the room, or the baby may become unsettled, or there may be still a little bit of birth fluid in the ear which may clear over time. This baby had an unclear OAE screen. The screener will explain this to mum and will repeat the screen either in hospital the next day or in the community once the family have been discharged. The third screen we do is called an automated auditory brainstem response. This time the baby's responses to sound are picked up through small sensors which are placed on the neck, shoulder and forehead of the baby. Soft clicking sounds are played through earmuffs specially designed for newborns. This screen can take up to 20 minutes to complete, during which time the baby's responses are automatically measured. Again, if the room becomes too noisy, or the baby is unsettled, or there is an existing permanent childhood hearing loss, it may not be possible to get clear responses, so some babies might need to be referred to Children's Audiology Department for further assessment. It's hoped, though, that the clear responses will be recorded at this stage, but just in case there is a hearing loss, it is important to keep any appointments made for you and your baby. Babies who have spent longer than 48 hours in the neonatal intensive care unit will be screened using both techniques, as these babies have a higher risk of a hearing loss. Regardless of the hearing screening outcome, some babies have risk factors such as congenital infections. These babies will be invited back at a later stage to assess the hearing status of the babies at that age. As we've seen, identifying a hearing loss as early as possible is important. Screening is quick and harmless, and your baby's hearing can be screened within a few hours of birth, and information and help is available at every stage. If you have any concerns about your baby's hearing at any stage, please contact your health visitor or a doctor. Newborn hearing screening does make a difference.